Deputy Derek Nolan. The need to address delays in the pain clinic at Galway University Hospital. The Deputy has 4 minutes to make an initial statement and 2 minutes for supplementary.
I'd like to welcome the opportunity to speak on this very important issue today. And before I begin, I would like to firstly commend the Minister for Health for the work he has done with regards to Galway Roscommon Hospital Group. It's making significant strides in tackling some long-held performance issues, and the new management team is seeing great results in reducing inpatient waiting lists and times, the emergency department count and trolley figures. I think it really is a tribute to the CEO, Bill Maher, the COO, Tony Canavan, but also to the cooperation from staff, nurses and doctors who are putting their shoulder to the wheel on delivering improvements, efficiencies and new ways of working. They all deserve real recognition and credit for their hard work and commitment. However, while we've seen some positive results in some areas of the health service in Galway, it is a harsh reality that waiting times in other areas remain simply unacceptable. I refer specifically to the urgent need to address the waiting times for the pain clinics in University Hospital Galway and Merlin Park Hospital. The waiting times in both places are totally unacceptable and are causing extreme distress and discomfort to many people who are in dire need of medical attention. In fact, I want to commend the staff who work in the health services with regard to the pain clinics for the helpful and cooperative fashion in which they've dealt with queries from my office. According to statistics that I received yesterday, there are now 583 people waiting on an appointment, with the longest waiting time being since August 2010. I've met with many people in Galway who have turned to me for help, completely exasperated with the delays in these pain clinics. One constituent who came to me for help and to highlight his plight was a gentleman who was diagnosed with fibromyalgia and who can suffer pain in all 18 tender points in his body. His condition has deteriorated over the last few years, but this year has been his worst to date. Almost every week there are at least 3 nights where he literally does not sleep and cannot even face going to bed because the pain is so bad. He used to have a photographic memory and was a very successful computer programmer. He now suffers from chronic muscle pain in his joints and nerves and experiences memory loss regularly. This man has been waiting since the start of the year to get an appointment at the pain clinic in Galway University Hospital. This constituent has been added to the waiting list on 3rd of January 2012. Today is the 24th of October, almost 10 months down the line, and this man is still waiting. He is still suffering from tremendous pain, and he is still fighting to maintain a decent quality of life. Since January, he has had one pain-free day, one day in 10 months that he did not have chronic pain in his joints and nerves. There are other cases that have presented to me, patients with chronic back pain, and another constituent with severe multiple sclerosis who was forced to wait for an injection that would restore mobility, the ability to work from home and dignity to her life. She was once able to receive these injections that she needed so badly every 8 weeks, but now that service has been scaled back. In the meantime, she is confined to bed, dependent on her family and unable to function properly. Minister, I'm aware of the challenges that are faced in the Department of Health and by the Minister for Health and the junior ministers. The HSE has always suffered administratively, and I do believe that the reforms that are being committed to will tackle some of these problems. However, the waiting times for the pain clinic at Galway University Hospitals have gone way beyond what is an acceptable health service. People who are in chronic pain are waiting for an appointment to give them some slight relief from medical conditions which have dominated their lives. I would ask you, Minister, to ask the Minister for Health to make a commitment to tackling this problem. It is extremely unfair to expect people who are living with debilitating pain to wait an intolerable length of time to get the treatment and relief they deserve. Thank you.
Thank you, Deputy. Tara.
And I'd like to thank Deputy Nolan for raising this issue, and I'll be taking the debate on behalf of my colleague James Riley, Minister for Health. Galway University Hospital has 2 consultants who provide a pain management clinic in the hospital. These are consultants specialising in anaesthesia, 50% of whose time is allocated specifically to pain management. 2 pain clinic sessions take place each week. In addition, the pain clinic has weekly theatre access for interventional and non-interventional procedures. To support this service, the hospital has provided a resource of 3 clinical nurse specialists whose time is divided between acute and chronic pain management for both inpatients and those attending the clinics on an outpatient basis. All pain clinic patients can contact these nurses by phone or bleep. Escalation protocols are also in place to address changes in patient symptoms. If a patient is on the outpatient waiting list and their symptoms worsen, they can contact their GP, who can liaise with the consultants directly. If a patient with chronic pain has an acute exacerbation of their symptoms, they can attend the emergency department. If an existing patient is experiencing any difficulties or worsening symptoms, they can contact the pain clinical nurse specialist directly. Patients who have received interventional pain treatment and require a repeat procedure are returned to the waiting list and are prioritised if cancellations occur. It is regrettable that a small number of patients have encountered delays in receiving appointments for the pain clinic. However, in line with the strict policies introduced by the Department of Health, patients are added to the pain clinic waiting list according to their referral date, and patients are taken off the list according to clinical priority and referral date. Since assuming office, Minister Riley has made it clear that priority must be given to taking care of those patients waiting the longest. Once the most urgent cases are treated, hospitals must devote their capacity to treating the longest waiters in a strict chronological order, which is the fairest approach. Progress in relation to waiting lists shows that even with reduced budgets and staffing levels, clear, well-informed targets assist hospitals to be effective. Within the last week, there has been a reduction in the overall waiting lists across the country of 16%. In Galway University Hospital itself, access for procedures has improved by 40% since 2011. Most notably, considering the difficulties it was encountering in December last year, the hospital achieved the 9-month primary targeting list for inpatient waiting lists on the 30th of September 2012. And I'd like to thank, indeed on behalf of the Minister, to thank all the staff involved and acknowledge their dedication and commitment to these significant achievements.
Thank you, Minister. Deputy, further 2 minutes.
And thank you, Chair. Again, before I respond properly, I just want to acknowledge and reiterate my complimentary position to the staff and the people working in the hospital for the dramatic improvement in many of the services. However, I have to take issue, and I regret, Minister, that it's yourself that's in the chamber and that the Minister for Health couldn't be here to take this topical issue, because I think it's an extremely important one. I have had cases of people going to the pain clinic who have rang the pain clinic on a weekly basis, whose doctors have written to the pain clinic asking for speedier decisions, asking for speedier treatment, asking for a quicker service, to which there has been no avail. So some of the response which has been provided to you by the Department of Health for the record of the House, I would argue is slightly inaccurate. It's certainly not something that a lot of the people I see are experiencing. While I appreciate the sentiment of the response, I don't think that sentiment alone is going to solve the problems. I think it's very clear the problem. There are 2 consultants, we may need more. There are 3 clinical nurses, we may need more. The reality is that people waiting for the pain clinic in Galway are people who are in pain. They're not waiting for a diagnosis, they're not waiting for any kind of other issue. They are simply in pain and looking for treatment for that pain. And every week longer they wait is an extra week in pain, extra month is another month in pain, and the time taken is simply one spent immobile in some circumstances or in agony in other circumstances. I'm not 100% happy with the answer I've gotten. I would ask you again, Minister, and I appreciate that it's not your brief, I would ask you to talk to the Minister for Health, Dr. Riley, explain to him what I have raised with you about the details of the cases, specifically the issue and the case that I referred to in my initial statement, and ask him to put a specific plan in place, perhaps via the special delivery unit, perhaps in agreement with the hospital management in the Galway University Hospitals, but a specific plan in place to deal with the severe delays and frustrations that sick patients in pain are feeling in the Galway University Hospitals, waiting for pain clinic appointments and suffering so much that in many cases their lives are debilitated and very difficult to live.
Thank you very much, Deputy. Minister.
Thank you, Deputy. And you have very clearly, stated the very difficult position that patients find themselves in. And I will convey directly to Minister Riley your concerns. I think we all want to see responses as quickly as possible to patients in pain or patients needing care in other ways. And you have acknowledged yourself the progress that has been made in various areas. But I will certainly convey to the Minister what you've raised here today, and you have made some suggestions as to how it might be addressed, including the special delivery unit. And again, I will convey it directly to Minister Riley. I'm sorry that I'm not in that department, so I can't give you a more precise answer than that, but I will convey it to the Minister.
Thank you very much, Minister. Item number 4, Deputies Billy Kelleher and Matthew McGrath.